everyone, it's Macular Week, so I'll talk a little bit about what the macula is and the leading cause of blindness in the UK called age-related macular degeneration, also known as AMD. Age-related macular degeneration is the most common condition generally affecting people over the age of 55. So what is a macula? It is responsible for your central vision and for seeing fine details clearly and most of our colour vision. The macula has a very high concentration of photoreceptor cells, the cells that detect light. They send signals to the brain which interprets them as images. There are two types of AMD called dry AMD and wet AMD. Dry AMD, the macula is normally clear of any deposits, fluid or bleeding. With dry AMD, there is also a build-up of yellow deposits under the macula, generally caused by the wear and tear at the back of the eye. Because the wear and tear is more located at the back of your eye, that is responsible for the central part of your vision. You will experience distortion or blurred vision in the centre of your vision. However, the side or your peripheral vision usually remains normal. So you may be thinking, can I have any treatment or injections for that? Now, there is currently no treatment for dry age-related macular degeneration. You may have heard of people having injections for AMD, but this is for a more advanced type of macular degeneration when abnormal blood vessels grow behind the macula. These unhealthy vessels can leak blood and fluid, and this pushes the macula away from the blood supply at the back of the eye and causes a rapid loss of central vision. Eventually, the bleeding and scarring can lead to severe permanent loss of central vision, but the eye is not usually at risk of losing all vision or going blind, as the ability to see in the periphery remains. There is also a rarer form of late AMD called geographic atrophy, where vision is lost through severe thinning or even loss of the macular tissue without any leaking blood vessels. So the second type is wet AMD. Wet AMD is a rapid central loss of vision with distortion. This occurs when abnormal blood vessels grow behind the macula. These, again, unhealthy vessels can leak blood and fluid, and this pushes the macula away from the blood supply at the back of the eye and causes a rapid loss of central vision. Eventually, the bleeding and scarring can lead to severe permanent loss of central vision, but the eye is not usually at risk of losing all vision or going blind, as the ability to see in the periphery remains intact. The good news is that there is treatment available urgently to prevent any further vision loss. Is there any treatment or injections for that? Well, with wet AMD, it can be treated if it is caught early enough, and this is normally done by injecting a drug into the gel inside of your eye. This shrinks the new blood vessels that are pushing the macula away from the back of your eye. You may need to have this repeated every few weeks for a few months, and this will normally be provided on the NHS. So what can you do? Regular annual eye exams are vital to monitor any changes at the back of the eye to ensure it has not progressed. This would also ensure you are within driving standards by monitoring the deterioration of your vision. There is also support from the Royal National Institute of the Blind and support from low vision services, where magnifiers can help you see fine detail, such as reading and other aids that can help you get around the house and maintain your independence. Good lighting at home is also very useful. Large brimmed hats and UV protected sunglasses protect your eyes from harmful UV rays of the sun outdoors. Eating green vegetables such as broccoli, spinach and kale contain antioxidants that can reduce the progression of the macular degeneration. Family history of AMD can increase your risk. Smoking is also a factor that can cause AMD, so efforts to quit smoking can help reduce the progression of the disease.